So let's talk about a different type of reconstruction that I do. So I talk a lot on this channel about breast reconstruction and reconstructing breasts after breast cancer surgery, but I also do perineal and vaginal reconstruction. So colorectal surgeons, gynecologic surgeons, general surgeons, they often call plastic surgery to assist with reconstruction of the vagina and the perineum after different types of surgeries. So sometimes when you're doing cancer resections deep in the pelvis, you need some extra tissue down there to reconstruct structures like the vagina where part of the tissue needs to be removed, or if you've had a history of radiation or you have a loss of tissue and you need some fresh healthy tissue brought into the mix, that's where plastic surgery is involved. So one of the most common ways that I do this is through a procedure called a VRAM, a vertical rectus abdominis myocutaneous flap. So flap procedures are where plastic surgeons take a piece of tissue from somewhere on your body and move it somewhere else in order to reconstruct that area. And we can do this in a pedicled manner where the tissue stays attached to its blood supply and it just gets rotated somewhere new. Or we can do that as a free flap where we completely remove the tissue, move it somewhere new, and we take the blood supply of that tissue and sew it to blood vessels in the new area with a microscope. So many of you are probably familiar with tram flaps, and that is a common procedure that is used for breast reconstruction. So that's transverse rectus abdominis myocutaneous flap. And there's a way of doing this procedure where you avoid harming or taking the muscle, and that's what a deep flap is. So for perineal reconstruction or vaginal reconstruction, we also utilize the rectus abdominis muscle, but we do it in a vertical way. So if you're ever interested in flaps and want to read about a big variety of them, there's a website called microsurgeon.org, and they talk about the blood supply, how the flap's done, a lot of nuts and bolts details, and it's really interesting. So when you take the rectus abdominis muscle, we leave it attached to its inferior or lower blood supply, which is the deep inferior epigastric artery, and there's usually 2 veins. So this flap can be used with just the muscle, and sometimes that's all we need for what we're doing, or you can take a piece of skin attached to the muscle as well. That's usually how I end up using this flap. So I think this came from the Plastics Fellow website. I can't remember, but this is a nice graphic of kind of how the shape of what we do. You can see the flap right here attached to its blood vessels, and then down below you can see how we rotate it on itself, and then we can utilize the muscle and the skin of the stomach for our reconstructions. And here's another nice photo that I found online. I actually have a very similar one of my own patient, but I don't have permission to use it, where this kind of curved area right here is going to be the skin paddle. So that's the skin and the sub-Q tissue that's removed. And then the blue and red underneath is the muscle, where you expect the muscle to be, as well as where its blood supply is supposed to be. So this particular method of reconstruction is an absolute workhorse when you're repairing the perineum. It can be used in so many different ways, and it's really amazing for women that have loss of part of their vagina, because we can reconstruct it with this flap, which is just amazing for patients. So this is just another type of reconstruction that plastic surgeons do. I usually work with my favorite colorectal surgeon, Dr. Karen Zagian, and I'll tag her in the comments. Please follow her. She has amazing information on her page.